Shri Gurubhyo Namaha. A very warm welcome to one and all, and a good evening to you all. I welcome you all on behalf of Ayurveda Map for today's session of Dahana, online sessions on understanding of gastrointestinal disorders and its management. Today's topic is Introduction to Common Digestive Disorders, and we have our guest speaker with us, Dr. Nisha Kumari, who has a BAMS, who has completed her BAMS and MD in Roga Nidana, and currently working as professor in Kundapura Rural Ayurveda Medical College, Udupi. Ma'am completed her BAMS from Alvas Ayurveda Medical College, Mudbidre, and has completed her MD in Roga Nidana from SDM Ayurveda Medical College, Udupi. She started her career from Alvas Ayurveda Medical College, Mudbidre, and she has rendered her service there. And also, she has worked as associate professor in SDM Ayurveda Medical College, Hassan, and she has worked as associate guide, PG guide, and also as a research scholar there. She has written a textbook on Roga Nidana and Vikriti Vignana, and currently she's writing another textbook on Sharira Kriya. She has rendered her service as professor and head of the department in Yenepoya Ayurveda Medical College, Mangalore. She has published various articles on national and international different journals and platforms. And also she has done her research work. She's doing her research work in gut microbiome and its influence on health in various systems of the body, role of regular practice of classical dance in geriatrics. She has also delivered many talks in various topics like Tvak Vikara, Ama, and various other topics related with Roga Nidana and Vikriti Vignana. And with the above accomplishment, she's currently working as professor and also the head of department in Kundapura Rural Ayurveda Medical College, Udupi. It's a pleasure to have you with us today, madam. We are very eager to listen to you. Over to you, madam.
Thank you, Dr. Akshata. At the outset, let me thank heartily Dr. Jasul for giving me this beautiful platform, Ayurveda Map. And I like to see furthermore such seminars, webinars with great topics along with stalwarts of Ayurveda. And I'm glad to share the platform with my teachers, my colleagues who are speakers in this forum. Thank you for having me. And without much ado, shall I share my screen?
Sure, ma'am.
Yes. I hope it's visible.
Visible,
right?
ma'am.
Yes. Well, the shloka says, as the continuity of life, with the features of life, the fate of health and nourishment are reflected as an aura, that is Prabha Varna. Most of the time we don't talk this. We only think that food is just for the sake of nutrition and we have digestive system only for the sake of nourishment. That's all. It's beyond that. The energy, immunity are all relying on the quality and the functionality of the Agni, the loss of which can take away life of human. It's not just continuity of life or maintenance of life. It's just the life itself is situated in this place. That is why this much prominence is given to Agni and the site where the Agni is situated, that is in the Koshta. So let's see what this Agni can do, what this Agni could do, and without correcting this Agni, we cannot proceed anything further. Ladies and gentlemen, I welcome you all for this session where I'm going to talk about introduction to various digestive disorders in Ayurveda, and sometimes we can have a small correlation with the contemporary science. The gastrointestinal system has been longest, largest, and the most complex system of the body, which nourishes all systems due to its complexity. The diseases also are complex, overlapping, and sometimes silent killers. Just because the system is complex, the disease also is complex. That is why many diseases like Grahani in Ayurveda are called as Durvidnyeya and Duschikitsa. It is difficult to treat because it is difficult to diagnose. Ayurveda believes that it is not most of the disease or many disease originate from GIT, but all the Nija Vikaras originate from the core of Kaya as Agni dwells here. All the pathology of GI disorders originates from Agni Dushti. If Agni Dushti turns, or if Agni turns Manda, then it gives Ama Jirna. If Agni turns Tikshna, then it gives Vidagdha Jirna. If Agni turns Vishama, then it turns Vishtabdha Jirna. Any forms of Ajirna is incomplete and improper digestive process where the end product is not in the form of absorption or assimilation. The result of digestion should be a possibility of absorption and continued as assimilation. If the end product cannot be absorbed or cannot be assembled, then that means the digestion is incomplete. The digestion is one word in modern science, but according to Ayurveda, it is in 3 phases, that is Pachana, Paka, and Parinama. Thus, the end product of Ajirna does not undergo further transformation or elimination. This is another problem. If the Ahara isn't getting digested, then it's getting stuck somewhere there. No transformation, no elimination. And such state of a compound is called as an ama. The ama, once formed, will definitely get associated to the body components to trouble the regular functions. It first invades the dosha and interrupts the regular functions of the dosha. When dosha fail to function and when digestion is impaired, the next concern is nutrition with dhatu poshana. We all know very well that after the completion of pachana and paka, then the ahara rasa that is produced will be converted into respective dhatus and the dhatus get nourished, which is called as parinama, resulting in dhatu poshana. Any point of this, if it is impaired, then dhatu poshana will not occur. Due to both reasons, the concern is nutrition that is absent, the digestion is also absent. So due to both reasons, that is samadosha and agnidushti, the dhatus will also get afflicted with ama. Before it was only ama, then it is samadosha. The presence of samadosha along with agnidushti now contaminates the dhatus. The new morbid compound, now it is a compound because it is not just one material, the undigested material, the presence of dosha, the continuity of agnidushti, and the association of pradushta dhatu produces a compound which cannot be eliminated, which cannot be transformed into another form. So this compound is called as, or it is named as ama, and it will keep exploring the body to find the new place to start the pathogenesis of the disease. The ama that is present for a brief period, it may keep quiet. It may not produce the disease. So this is what we call it as Sannikrishta Hetu and Viprakrishta Hetu. Soon after the Utpatti of ama, some people may show the symptoms of GI upset. That can be Sannikrishta Hetu. But without showing any symptoms, this ama can keep quiet for a long time. That is what we call it as Leena Dosha, as in case of Grahini and Shwasa, as well as Apasmara, where after a long period, the disease may show off as episodes. This exploration happens through a circulation because the ama, along with dosha as well as dhatu, keeps traveling the body, finding which is the weakest point of your body to produce a disease. When the ama finds there is a kavai gunya in your body, that is a suitable place for the ama to reside and start its new pathogenesis there. So this is Paridhavamana dosha of Sama dosha as well as Dhatu that happens in the Srotas. Because anything that has to travel from one place to another, it has to happen through the Srotas only. When the Srotas as well as Ama gets interacted, then the Srotas will identify the changes that is present in the content in which it is carrying. Why? Because Srotas are used to carry the body tissues, body elements, may that be dosha, dhatu, mala, which is having its own biochemical structure. when there is a new compound produced, the Srotas can identify there is something change in the biochemistry that it has been carrying since long. The Srotas as sensitive, where it identifies something unusual is passing by. The Srotas which reacts, that results in Srotodushti, and that is how many symptoms are produced right from Srotodushti. Here, when Dushta dosha, Pradushita dhatu, along with Ama, that is what we call it as a compound, circulates, before it reaches the Kaivagunya Pradesha, the Srotas may show its sensitivity and react in the form of Chardi or Atisara or something like that. Before that, before it reaches the Kaivagunya Pradesha, the Srotas may try to express that there is something bad that is getting circulated inside the body. If it is gross, we can throw it out in the form of Chardi or Atisara. But if it is minute or microscopic, atherosclerosis happens where long-term deposition of Dushtamedas happens in the walls of the channel. That is what Sannikrishta as well as Viprakrishta Hetu is about. The Srotas will react and results in Srotodushti. And 4 forms of Srotodushti may happen here because it is carrying Ama along with it or within it. The 4 forms of Srotodushti are Atipravriti, Sangha, Vimarga Gamana, and Siragranti. The Ama traveling in the Srotas and Srotas causing Dushti will harm the Ashaya or the organ to which the Dushita Srotas is connected to. The Ama will engulf and spoil the Ashaya where it has reached to reside. Both will produce Vyadi. The Srotodushti can produce Vyadi. The Ama that has reached to the new site can produce Vyadi. The Dushta doshas and Dushta dhatu coming in the new Ashaya also can produce Vyadi. All these 3 can combine and also produce a Vyadi. So there are 3 components that can produce Vyadi at this point. Number 1, Dushta Srotas. Number 2, Dushta dhatu, Dushta dosha, as well as association of Ama with it. The Utpatti of Ama, Dosha Dushti, Dhatu Pradosha, Sroto Dushti, all these collectively produces Vyadi. So this is Vyadi Dravya, irrespective of any kind of Nija Vikara of GIT. All Vyadis of GIT, anything right from simple Aruchi to the complicated form of Udara, you have 4 components in the disease. The Ama, the Dushta dosha, the Pradushita dhatu, as well as the Srotodushti. So while you give chikitsa to the patient, you have to treat Ama, you have to dissociate Ama from Dushta dosha, you have to cleanse and revitalize the dhatus and correct the Srotodushti. If Atipravriti is happening, silence the Atipravriti. If Sangha is happening, clear the obstruction. If Vimarga Gamana is happening, guide the right direction of Doshagati. This is why you have different kinds of treatment. Sometimes Shodhana, Shamana, Stambana, Lekana, Ullekana. All these kinds of chikitsa are there. Deepana, right from Pachana, Deepana, you have different varieties of treatment methods, upakramas, because you are addressing these 4 components of Vyadi. So what specifically happens during this phase in GI is alternation or alterations in the quality and functions of the digestive enzymes as GIT nourishes the entire body, integrates with all the other systems, and number of pathology and diseases are arising in the number of diseases as well as symptoms are highest in GIT. You can see a respiratory system, you may have cough, you may have breathlessness, these kind, okay, chest pain, fine. When it comes to Hridroga, either there is cardiac failure or cardiac arrest. When it comes to GIT, there is a vast array of disease, lots of symptoms, and many times uncountable from vague to acute, acute to chronic. You have this much number of disease in this system because it is associated with other systems of body also. If you go to Pranava Sroto Mula, they never said about Pufusa. They said Mahasrotas as well as Hridayam. Why Mahasrotas is included as a part of it there? Because it is the Mahasrota that gives essential elements to carry prana. You want to carry oxygen in your body. Oxygen as such cannot be possible to travel and reach every cell of your body. Oxygen has to go along with the hemoglobin only. The hemoglobin is derived from the Rakta Dhatu, and Rakta Dhatu is originating from the Rasa Dhatu. And Rasa Dhatu Utpatti happens from the Ahara Rasa, from the food that you are consuming. So this is how the GIT is related to respiratory system, GIT is related to cardiovascular system, GIT is obviously related to excretory system, because whatever is not absorbed directly goes to the excretory system. You also have gut-brain axis, where your psychosomatic aspects happens are governed by enteric nervous system, which interacts with the central nervous system. You have disease like Amavata, which is originating from GIT and later goes to the locomotor system and also to the cardiovascular system. We also have a saying that the rheumatic disease licks the joint as well as bites the heart. The Ama Utpatti happens in the Amashaya. The Sandhi Dushti happens in the presence of Vata Prakopa in the Sandhi, and Hridroga also is one of the Upadrava of Amavata. Hence, as it is related to almost every system of the body, correction of the disease, correction of the symptom, and correction of the system is complex and time consuming. And all the disease in a long process, it may not be restricting to GIT. It may slowly progress to other system of disease also. The structural malformation, the functional impairment like food propulsion, peristalsis indicates the phase of Srotodushti or Prasaravastha of the Kriyakala in GIT. Microscopically also, it attacks the microbiome of our GIT. That does the transformation of absorbed food. The principal function of our microbes, the friendly microbes in our GIT, is to convert whatever is been absorbed into the tissue materials. The process of fermentation and transformation happens in the presence of microbiome, exactly like that of our Kshiradadi Nyaya, which is explained in Dhatu Poshana Krama as well as Dhatu Utpatti method, where Kshira can be converted into Dadi. In the same way, the Dhatus from the Ahara Rasa will be converted into respective Dhatus. Here also, our microbiome does this function. But when you have Ama there, this kind of positive way of transformation or regular transformation is absent or will not be there. Instead, there may be toxins synthesized in that, to which the microbes will be influenced, and they also react repulsively to the unwanted compound that has been produced in your GIT. Because the microbes in the gut transform the absorbed materials to the tissue of the body, and hence we get nourished. Due to the Ama and Srotodushti, this microbial ecosystem is disturbed and they produce dysbiosis. Due to dysbiosis, a new form of compound is produced, which can be the Ama of Dhatu level. Cross level Ama also can be there. Dhatugata level Ama also can be there. And Dhatuagni Mandya level, because of Dhatuagni, even though Jatragni is fine, but Dhatuagni Mandya is there, then the Ama Utpatti happens in the Dhatuagni level. These are the biochemicals and toxins. What happens in the micro level of Amotpatti and its interaction with the microbes of our GIT is the biochemical toxins that are endogenous, which are released by the gut environment. Release of these toxins will invite inflammatory response. To this inflammatory response, our immune system may respond in different ways. To this inflammatory response, our immune system will respond in different ways. Complex chemicals, cytotoxins, and various gases will be liberated during this process. We speak about Anaha, Admana, Atopa. It's not a simple thing. The liberation of toxic gases, including methane and hydrogen, happens when this Dushta Dosha, Ama, gets interacted with the microbiota present in our GIT. So liberation of this gas also can go to any part of the body and produce even neurological symptoms. So which This gives various outcomes as disease manifestation. The disease of GIT begins with vague and less severe form of disease like ajirna, aruchi, that can be common factor in almost every disease. Before discussing about the samprapti, it is necessary to know the nidana of the diseases of GIT. Of course, different disease may have different nidana, but I'm just talking the common nidana, but why those nidanas are highlighted in almost every nidanas. The first nidana is always related to ahara, as the system is related to annamaha as well as purishava srutas. Atyambupana includes the fact of atimadhyapana destroying the mucosal lining and formation of the aldehydes. Visha utpatti or visharupi ama, this is what happens. Vishamashana is the mixture of food that cannot be broken from large chains to single molecules. Whenever we eat any carbohydrates, it has got polysaccharides. Polysaccharides are broken down into disaccharides. Disaccharides are finally broken down into monosaccharides, and monosaccharides are absorbed. Similarly, when it comes to protein, polypeptides are broken to dipeptides. Dipeptides are broken down to amino acids, which here, in case of ama or ajirna, it doesn't reach the final stage. The polysaccharides doesn't reach the monosaccharide stage. The polypeptides will not reach the amino acid stage. It remains halfway, either disaccharides or dipeptides, to produce a compound called ama. Even in case of Visha Prayoga also, it is the same thing happening. See, we have heard about Dushi Visha, Gara Visha. Now, I will not go to Agada Tantra part of it. But what actually is done there, Visha Prashana, how it is done, it's not the poison that kills the patient immediately after taking the food. When the food is mixed with Visha and Visha Prashana is done, slowly and gradually the person's health deteriorates, behavioral pattern deteriorates, personality changes, and that is how it happens. But what exactly happens inside? The poison is fed to a reptile and it is allowed to die. The reptile is allowed to decompose, and the decomposed drops are put to the edible food, and this food is eaten by the host. So directly, they won't give poison. They will feed the poison to any reptile animal like a snake or lizard or something like that, and that will die. And when the dead reptiles is allowed to decompose, and then it is just few drops are added to the ready-made food, and then it is allowed to eat. Now, why it is so complex? The poison is not like other poison where the person eats and dies immediately. Here, what happens is the production of secondary metabolites derived from the reptile. When you feed a poison to a reptile, in the intestine of reptile, a secondary metabolite is produced. And this compound, when it mixes with the decomposed structure of a body of the reptile, the enzymes and coenzymes of the body of the reptile, again produces a very, very big compound. And when the person eats it, then this compound cannot be broken in the gut of the human who has consumed it. You cannot break it, just like polypeptides cannot be broken into dipeptides and to mono amino acids. It cannot be broken, so it remains. Then it cannot be broken, and conventional medicines or antidotes will not act on such compounds. It will remain, and remain. What it does remaining there? Almost like an activated charcoal, it absorbs all the essential nutrients there, and it may produce symptoms like gulma and all, where all good things are sucked and absorbed in one spot where this compound is present, and the person starts to lose his energy. It remains inside the body for long, decomposing the lining of the GIT in an alive patient. The compound turns more complex, and when it interacts with the body tissues, new foods that are ingested produces and it stimulates unnecessary neurotransmitters, giving rise to psychotic features. So patient may act insane, speak irrelevantly, pralapa, features of unmada, can be there just by such kind of vishaprashan. Such compounds are cytotoxic and cause damage to the nerve cell or neurons, giving rise to psychological disorders, staying remote in the gastrointestinal system because we have gut-brain axis. You know that why Shodhana is emphasized in all GIT as well as Manasika Vikaras. You can see Chikitsa Unmada, Vamana is indicated. There are also remedies in the form of Virechana to Manovikaras. Apart from Sharirika Rogas, Manovikaras also there is gut cleansing. Why is that so? Because knowingly or unknowingly, such compounds dwell in our GIT and produce these kind of symptoms. So removal of this, it can produce Unmada Pasmara-like symptoms, it can produce Kushta-like symptoms, it can produce Grahani as well as Pravahika-like symptoms, Gulma-like symptoms. It can lead to any kind of disease right from there. So that is why Shodhana is emphasized. It is to eliminate all these cytotoxic compounds and neurotransmitters that trigger through the gut-brain axis. Here, here Sandharana in the Nidana refers to Vega Vidharana, especially Vata, Mutra, Purisha Vega. I'll emphasize on Vata Purisha, Vata as well as Purisha Vega. When there is stool retention, if the patient doesn't defecate, the retention of stool occurs. What is present in the stool? They are nothing but nitrogenous waste, indole, skatole present in the stool. It will be absorbed by the colon mucosa that can reach the bloodstream. Addition of all these to the blood causes the change in the blood biochemistry. Such blood travels in the circulation and also reaches the brain. The brain, being sensitive, identifies this unwanted chemical change of the blood and shows non-acceptance by producing heaviness, headache, nausea, insomnia also. See here, the patient has not passed stool, yet he can produce symptoms like headache and nausea. So many patients you may get across, they say, I'm having headache, I'm having headache. Please ask one question. Are you being constipated? If the answer is yes, the treatment is not for Shirashula. Don't give Patyadi or Shirashula Vajrarasa. Giving a small cleansing in the form of Triphala or Avipatikara Churna acts wonders. And here they have also told about insomnia. Nidra Viparya, Alpa Nidrata are also told as a Nidana of GI disorders. So Sapna Viparya, what is told here? You see, the sleep and digestive systems are directly related in many ways. One of the chemical relation is melatonin and pancreatic juice, which are inversely related. Melatonin initiates sleep and pancreatic juice, of course, the digestion, especially carbohydrates, that is glucose. When we sleep and just wake up from an inadequate sleep, our body will be still under the influence and the control of melatonin. And at this time, pancreatic juice will be inactive. The pancreatic juice cannot be activated until and unless melatonin drops down completely. Similarly, when pancreatic juice is active and doing its job of breaking down, at that point of time, melatonin cannot initiate sleep. So, do not eat your breakfast if you are still sleeping, and do not sleep after you eat. Coming to Kala and its role in digestion is also that, as I said just now, the biological clock spontaneously activates and deactivates your hunger and digestive meter. It is subjective. Everybody has got different hunger reflex getting initiated. Some may feel breakfast hunger early in the morning. Some may not feel like eating soon in the morning, even though forcefully they eat because of their routine or schedule. They may feel vomiting reflex or gag reflex. So it's better such people have their breakfast at 10 o'clock, not 7 or 8 in the morning. That is why it is called as, because it is subjective. And hence, some people cannot have breakfast early in the morning and others can. This is due to melatonin levels still high and the body still hasn't started to activate pancreatic juice. This is completely related to Kala and it cannot be altered. Well, textual references also say about Agni being intense during Hemanta and Shishira Rutu and weak during Grishma and Varsha Rutu. Coming to Satmya and Asatmya are those elements which do not and does the stimulation of inflammatory response respectively. Satmya will not stimulate inflammatory response. Asatmya will stimulate the inflammatory response to which an individual is previously sensitized. Satmya do not, but Asatmya ahara or asatmya dravya sevana stimulates the hyperactivity of the immune response to which a patient is previously sensitized. This is the reason why Virechana, Vamana is indicated in Shwasa, Kushta, Shita, Pitta, and Udarta. This Vamana Virechana is not only for GI disorders, but also all the other disorders. Though the hypersensitivity response are seen in cardiorespiratory system and skin, the primary stimulation occurs in GIT as a response to asatmya. That is why Tamaketu Virechana has been told. We give Virechana in Tamaka Shwasa, which is completely related to respiratory system. The patient will stop having Tamaka Shwasa when Virechana has been given. Why? Because Udbhavasthana is displaced because of the presence of Asatmya Dravya that unnecessarily stimulates or produces allergic response. Inflammatory factors may be present in GIT due to chronic remnants of food particles that are adhering in the walls of GIT since ages. That is what Viprakrishta Karana is about. Today you have eaten something. It may not produce symptom immediately. It may keep quiet. After a long time, it goes on accumulating. This is what we call it as Vyanjaka Hetu. Small causes assemble, and one fine day, it will erupt outside as a major outbursting of the symptoms. This also can happen. And that is what we call about inflammatory response happening acute as well as after ages. As a result of this manifestation of all these kinds of symptoms will manifest. Next is psychological factors causing the upset of GIT. What is this Irsha, Krodha, Bhaya? Why it is included as a Nidana of GI disorder? Irsha, Krodha, Bhaya will elevate HCl, adrenaline, and cortisol respectively. Irsha will increase HCl, Krodha may increase adrenaline, and Bhaya or stress can increase cortisol. Irsha, jealousy stimulates HCl and then it again triggers autoimmune disorders. Recently, I heard from a gastroenterologist how emotions like hatred causes autoimmune disease. Hatred is a very bad emotion. Though I didn't get any other textual or research article, experts still believe so. Take it to cortisol. It is secreted as a response to stress. When a person gets intense hunger in such condition, but he will never get satiety. So binge eating, what we call, some people will grab something and they go on eating. Their stomach may be full, but still that crave will be there. They won't get satiety. This is because of increased cortisol level, and cortisol will confuse the brain and inhibit the satiety center, and you will never be satisfied by eating any amount of food. Binging will accumulate fat, leading to bloating and obesity. They can never lose their weight and abdominal girth unless they bring down their cortisol levels. You might have seen so many people trying out different workouts, diet, yoga, even Udvartana. Still, their abdominal girth is never decreasing to a single gram because their obesity is because of cortisol levels. Unless you bring down the cortisol levels, they will never respond to any treatment that you give. The long-standing disease of any system reflects on GIT, and any impairment of GIT can influence the functionality of all systems. So I think every religion and in every culture of the world, there is a practice of paying respect to food, praying before eating, and eat with no hatred, rage, or any such bad emotion. May that be in our Ashtahara Vidhi Visheshayatana or Ahara Sevana Vidhi, or in take any religion at any corner of this world. There is a practice of sitting in front of the food and praying God to bless the food and nurture the body. Otherwise, ultimately, ingested food also carries cortisol, adrenaline, and excess HCl to the system because of bad emotions. That is what it is written here. Na samyak paripakamiti. It will not yield Shuddha Ahara Rasa, which does Dhatu Poshanam. It instead produces Ama that yields disease of all kinds. It all begins with the vague symptoms like aruchi, agnimandya, as I said. So this is what I said just now, where just one small accumulation or dysbiosis or impairment of metabolism in the GIT, it will produce its effect in various systems, or I can say almost every system of the body. That is why Koshta, Kayagni, Agni is given such a high importance. If you see the chapter of Grahani, initially it may look like only abdominal related symptom, but later on you can have in the Upadrava or in the end form or later stages of Grahani, almost every system, every symptoms are present. As I said earlier, the aruchi as well as ajirna may be the initial signs of all GI disorders, initial features of dosha vaishamya, initial feature that remains throughout. It can remain as symptom of other disease like jwara, raktapitta, pandu, where GIT is the udbhavasthana, though they may not look like GIT disease precisely. That is why GIT system as well as jwara we have not understood. Charaka explained jwara as a first, whereas Vagbhata, he has given emphasis to GIT as a mula of sarvaroga. Even though there is a difference in the picking the name, which originated as a first disease and which is the most commonest system which can cause disease, there may be a difference, but ultimately one thing that is common in sarvaroga also, atisara also, jwara nidana also, that is GIT. It is all due to ama, which is a barrier in the tongue as a morbid coating that is an obstacle for taste bud. I am talking here about aruchi. The presence of aruchi directly indicates the initial phase of amotpatti in your GIT, but we ignore this. It is due to the presence of ama, the hunger reflex is not manifested. So aruchi in the form of anorexia or in the form of loss of appetite is also there. So aruchi, arasanyata, in the as tastelessness as well as loss of appetite, both are understood in the name of aruchi. It is due to inhibition of agni, the ingestion, digestion will not be as usual. So here we're talking about dyspepsia, which is in the modern parlance. I'll be talking about all GIT in Ayurveda in modern parlance. It need not be the same exactly, but somehow some symptoms may be similar. It may be easy for you to treat or understand it better or wherever required. It may help you to pick which is the suitable investigation. That also you can come to know here. Dyspepsia is another word for indigestion. People with chronic indigestion often report feelings of stomach pain, overfullness or bloating, or during and after eating. Other common symptoms include acid reflux, heartburn, and excessive burping. Many people get indigestion after an especially large or rich meal. This is because digestive system is working harder than usual to accommodate a heavy load. Stomach gets stretched, gallbladder and pancreas get contracting, and they all are producing a strong digestive juices, which may be irritating the tissues. But indigestion that lasts longer than one meal or that comes and goes chronically is often less simple. There may be a variety of factors involved, sometimes no organic cause, or sometimes there can be organic cause. So functional dyspepsia also can be there, and because of mucosal irritation also there can be dyspepsia. So dyspepsia related to vataja can be functional. So pittaja may be because of increased enzyme secretion, and kaphaja may be because of increased mucosal secretion. Yes, this is the anaha, admana, atopa. I'm talking about the second phase or second set of disease after aruchi, after ajirna, as a response of ajirna, because ajirna means stasis of food, liberation of gases, toxic gases happens. So anaha, admana, atopa we can discuss here. The feature of dysbiosis, the feature of disequilibrium, the feature of accumulation, the feature of ongoing pathology, Prodromal signs of many disease. It can be Pura Rupa of many disease. As in case of Atisara, it is one of the Pura Rupa. Feature of stagnation and stasis. It can be one of the Rupa in Udara. The same is the Pura Rupa in Atisara. It can also be one of the symptom in Amamata, Pura Rupa in Amamata also. In case of Kumbha Kamara, it can be a feature as Upadrava also. Here, we can discuss about all those kinds of elements that brings different kinds of response to the patient's body by consuming high fat, alcohol, NSAIDs, and stress as well as anxiety, which I told just few slides ago when I was talking about the Nidana of Annamaha Sruto Dushti. Apart from that, all dyspepsia, that is Aruchi, Agnimandya, Anaha, Admana, Atopa, can be present in the later stage of diseases, which has been explained here. I'm going to talk about this in my later slides. After manifestation of Anaha, Admana, Atopa, again I'll repeat, first Aruchi, Ajirna will be there, and soon after either one of them, not all, Admana may be there or Atopa may be there. And in a very short span of time, or sometimes together, Shula will manifest. Because of stretching or because of bloating, there can be Shula, or otherwise also there can be Shula. Vata is a predominant cause for manifestation of Shula, because all those muscles of GIT are made up of smooth muscles, which are connected to the parasympathetic nervous system. And this mechanism of sensation of pain in the abdominal region is felt. So that is all Vataja. Apart from that, Kledaka Kapha, which is the mucosal layer or the mucin, which is the defense mechanism against all kinds of any kinds of microorganisms that has entered or infective organism that has entered or excess HCl that has been secreted. If kapha is too much there, then that mucus will again stimulate reverse peristalsis that can manifest in the form of chardi. So Kledaka kapha coming out, the mucus coming out in the form of kasa as well as chardi is because of excessive secretion of mucus. The pitta, which is correlated with HCl and pepsin, is the aggravating factor that can be seen in Amla Pitta, Parinama Shula, as well as Anadrava Shula, or in any other kinds of Tikshnagni related Vidagdha Jirna. Now, we are having different kinds of pain here. When we talk about pain, it can be somatic, it can be visceral, referred pain, chronic pain, and also sometimes pseudo pain also. Very interestingly, there was one woman who had her hysterectomy done, and she still, every month, she feels menstrual cramps. So that kind of pseudo pain also can be there. Some people, they opine that it is a kind of gulma also. We'll discuss that in my upcoming slides. So all that neuropathic pain, functional pain, radicular pain are all different kinds of pain, which comes as a response to the presence of irritants which irritate the lining of mucosa, because of which parasympathetic nervous stimulation happens. That means Vata aggravates and produces Shula. Vata the Shula, the spasmodic pain, as you see in case of intussusception, volvulus, colic, as well as cramps. Pitta the Shula in case of pancreatitis, cholecystitis, appendicitis, diverticulitis, and all those kinds of inflammatory and infective kind of pathology comes under Pitta Shula. The obstructive pathology as well as neoplasia comes under Kapha Shula. And whenever you call Sannipataja, that is because of malignancy, the cancer. Annadrava Shula can be because of gastric ulcer, and Parinama Shula is because of duodenal ulcer. The next, now this up to Shula, any disease can be there. This is Samanya Samprapta up to Aruchi to Anaha to Shula. Almost every GIT will be there. And here onwards, Vishesha Samprapti occurs. If at all if the person is consuming Pitta Prakopakara Ahara, he may land up in Amla Pitta, not other disease. Amla Pitta, as I said, it's a Pitta dominant only. And Tikshnagni is the underlying pathology here, where Vidagdha Jirna occurs. And in Vidagdha Jirna, the Ama again produces material or Drava, which is even Tikshna than the Pitta itself. So that is why Daha is there. because the pitta nature or pitta drava is doubled here. The pitta that you already have naturally is there, plus the ama that is produced will also be having similar feature like that of pitta. So that ama as well as pitta will double the irritation, and this irritation cannot be tolerated by the GIT. So as a result, the patient experiences severe amount of daha, and there can be regurgitation, vomiting reflex, and once the patient vomits, he may find relief. The patient, when he vomits, there can be tiktasyata, dhumayana, dhavatu, daha, greenish material coming out along with the vomiters, directly indicates samapitta. It is nothing but the combination of unmetabolized rasa and undigested food along with rasa, and this is amlapitta. What we call hyperacidity is the correlation to that of amlapitta, which is acid reflux. Some people call acid reflux or acid dyspepsia. Many names it has got. What is there is increased secretion of GIT, which are acid, will cause regurgitation. The stomach is having different epithelium. The esophagus is having different epithelium. When the contents of the stomach is very irritative, even if the stomach itself cannot tolerate that much irritability of the digestive juice, it will start regurgitating. And the esophagus doesn't have protective layer like that of stomach. That time the person will feel excessive burning sensation. The esophagus is present just close to the heart. So the burning sensation in the chest is more rather than mere pain abdomen. So this hyperacidity can cause stomach ulcer. Stomach ulcers, in stomach ulcers, there can be hyperacidity. So both are there. When the patient comes to you with hyperacidity, and if the stomach ulcer has not manifested, please think that amlapitta is a pura rupa of anadravashula or parinamashula. If the patient has already come to you with stomach ulcers, that means assume that for a long period he has suffered from amlapitta. He never underwent proper treatment, and that is why he has landed up in stomach ulcers. Because hyperacidity or amlapitta is the first phase of parinamashula. Apart from that, acid reflux disease, stomach cancer, and food. Let us not talk about food because it is already told as a nidan. The typical feeling of restlessness, feeling of nausea and vomiting, sore belching, stiffness of stomach, lack of desire for any other food, indigestion, constipation, substernal burning, hypersalivation, fatigue, and increased stress will be there. Why stress will be there? Why there is restlessness? Because of cardiac manifestation. So it produces a lot of discomfort to the chest. So close by you have heart, there can be increased heartbeat, and the patient may have fear, whether it is a cardiac arrest, am I going to die? This kind of fear also the patient will face. There can be a phase where pulse rate as well as the BP may fall down and patient may feel giddy, and a more transient loss of consciousness may also happen because of this severe spasm as well as irritability. It is also another form of amlapitta itself, where we call it as GERD, gastroesophageal reflux disease. Here, this is vata as well as pitta related disease. In the previous amlapitta or hyperacidity, what we spoke is the amount of stomach enzymes are high. Whereas in this case, the amount of stomach enzyme may be normal, but the stomach is producing unwanted reverse peristalsis. Here, vata dushti has occurred. It may be an udavarta nidana. It may be udanavata dushti, where the anuloma gati of ahara is now going upwards from down to upwards. That is the difference between amlapitta and this kind, or hyperacidity and GERD, where the amount of acid may be normal, but because of upward movement of acid, so it may go to the esophagus to produce burning sensation. In case of hyperacidity, the quantity of acid was too much that stomach couldn't accommodate that much amount of acid. That's why it went to esophagus. Whereas in GERD, the amount may be normal, everything, it may be HCl, it may be bile, any digestive juice, it may be normal, but Instead of going from stomach, it has to go to the duodenum. From duodenum, it has to go to the small intestine. But here it is not happening. From the duodenum, it is going to stomach, and from the stomach, it is going to the esophagus, and the person is regurgitating. So this is GERD. Well, coming to the another important disease, that is Chardi. So like Amla Pitta, also you have having Urdhva Amla Pitta, there can be Chardi, and Chardi as a mucus, excessive mucus production, Kledaka kapha production also Chardi can manifest. Chardi can be there in GERD also. That is why Pittaja Chardi, what we call, can be related to GERD. And Kaphaja can be related to the excessive mucus production, and the Vataja is just neurogenic. The act of vomiting where contents of stomach regurgitate upwards and get out to expel through oral cavity to cause gastric emptying is Chardi. Normally, it is a defense mechanism to throw out foreign or indigested material from the stomach. I would like to remind you, just a few slides ago, I told about Amotpatti, and this Ama will not be eliminated, it never be transformed. That is what Ama is. But if you are lucky, Ama can go out of your body, and the only possibility of Ama getting out from your body is Chardi. So, Ama unusually gets eliminated outside, natural. That is Chardi. So, if a patient has vomiting, then that means Ama is going out without producing further more damage to the body. The Ama, if it is remaining unchanged, is dangerous. The Ama going out from the Chardi is actually good. Naturally, the body is going out. So if the patient is coming with Chardi, it's good that the body has identified Ama and body is removing out Ama, and Ama is also agreeing to come outside without making much tantrums. So this is what Chardi is about. So it's a common GI disorder characterized by bouts of vomiting, nausea, pain, and blackouts. Because why blackouts? Because it is causing squeezing of the stomach. At the same time, it is causing squeezing of the chest muscles also. And the muscles of the chest are also involved in respiration. And the muscles of the chest also gives pressures to the heart or chest. So that is why vomiting is distressful. At the same time, Vamana has got more complex than Virechana. It may be easy for you to administer Virechana, but it is difficult for you to, or risky for you to administer Vamana because of this reason. The muscles of the abdomen, okay, no problem. But the muscles of chest, muscles of respiration, muscles of neck, muscles of face may undergo severe spasm, which may impair respiratory process as well as cardiovascular activity process also for the time being. And if it is too dangerous, it may also produce blackouts as well as unconsciousness. So implement Vamana judiciously, and while the patient is undergoing Chardi, look that such severe spasmodic contractions are not there. Well, apart from that, Ama, if it is because of Ama, go with Ama Pachana. If it is because of Pitta, let all the Ama content go outside, and after the Ama is eliminated, then you can think about pacification of vomiting reflex. Till then, let the patient vomit and cleanse the GIT, which is filled with Ama. This is what I was talking just about, the vomiting center that is present in the pons as well as medulla oblongata. And there is a center, and very close to the same center, you have respiratory system. So this neural pathway can interlink, because of which respiration can be ceased or paused at a moment, and vomiting is stressful, and the patient may have very, very tiresome act of vomiting, and forcible ejections of gastric contents can be distressful. Only thing is you have to see here is let the patient vomit comfortably and stop all kinds of unwanted spasm here. That is how you manage Vata Jachardi. Pitta Jachardi, Kapha Jachardi, then it may not be that distressful compared to that of Vata Jachardi. Vomiting is usually associated with nausea, retching, salivation, anorexia, and dyspepsia. And why anorexia, why dyspepsia? The previous few slides I have already told you, because it is nothing but the feature of Ama only. Apart from that, Chardi may manifest as Lakshana of other disease. Chardi may manifest as a complication of other disease, but it is not directly because of the Ama in the stomach. That is what when we are talking about uremia and all. when we talk about stone in the kidney also. So that spasmodic contraction, it is not because of ajirna the patient is vomiting. So dvishtartha chardi also. It is neurosensory, not at all GIT related. So that part let us not discuss here. Here I'm talking about that vomiting, which is because of impairment of GIT functionality. Well, if this is the feature of upper GIT upset, similarly, the lower GIT upset happens in the form of atisara. See, what actually is atisara is, it's a very simple thing. Whenever your floor is dirty, you will use broom. If it is dusty, you will use broom. But when you have something which is sticky, what you do is you put water and flush it away. That is what your lower GIT does. Somehow, AMA managed to come down to the lower GIT. It has, from Amasha, it has crossed to the lower part of the GIT. Then the lower GIT will eliminate in the form of atisara. Here, what helps the manifestation of atisara is secretion of udaka to the GIT. Lot of udaka or water comes to the GIT. So here udakava srotas is involved along with purishava srotas. To remove little bit of ama, lot of udaka or drava is flushed to the GIT and the patient eliminates drava mala sarana. Here, when you treat the patient of atisara, you focus more on hydration because the patient will has got high chance of going for dehydration. What kills the patient in atisara is dehydration. So your first line of treatment is always rehydration, but not to stop atisara at all. Even according to Ayurveda Chikitsa also, you have no stambana at the first go. Anulomana has to be done or allow the doshas to go outside on its own. Just see that the patient is not going to lose conscious or something like that. Shama, klama, glani should not be there. He should be alive. Allow it to go. Once the dushta doshas goes, when sama mala goes, only then you start atisara chikitsa or stambana chikitsa with kutaja, etc. are being told, but not before that. Now, here also, the body is trying to flush away by using udakava srotas help and eliminate it through anorectal route. So the act process results in excretion of watery stools. This is the reason why you have dravamala sarana from the anus, and hence it is called as atisara. Here, the what mala comes, it is not the ama coming out from the anal canal in atisara. It is ama that is mixed with partly digested food, ama along with water, ama along with digested material completely comes outside. So it's a mixture of everything. Not only ama coming outside. Whereas in case of chardi, such amount of water doesn't come outside. The mere food along with mucus comes outside. Whereas in lower GIT, the ama comes out with the help of drava or udaka. The disease atisara resembles the clinical condition of diarrhea, which is defined as passage of frequent liquid stools. Usually more than 200 grams of stool you have daily, but if it is more than that and it is watery, then it is called as diarrhea. Well, it can be seen in different conditions apart from mere indigestion, that is enteritis. So enteritis is one such condition where you have inflammatory response to any contaminated water or polluted water or something like that, and the body responds in dushta dosha present there. The lining of the lower GIT will show irritability, because of which peristalsis movement will be increased. Because of increased peristaltic movement and also because of secretion of water, both the patient will have increased frequency of stool excretion and also increased quantity of watery stools. Psychogenic diarrhea. Why I have added this diarrhea particularly because to talk about motility. So the patient is having normal jirna or normal pachana, but before completion of pachana, the peristaltic movement has started. You know very well that there are different types of contraction. You have gastric contraction, you have foot propulsion, you have segmentation, you have peristalsis. So after which segment of the GIT has to start initiation, that is all planned according to Avastapaka as well as Nishtapaka. When Avastapaka is going on, that time peristaltic movement should not happen because it is still going on. When the Avastapaka is going on, that time if peristaltic movement starts, then the digestion will be in the halfway, Pachana will be in the halfway, And in the halfway of Pachana itself, the contents of the GIT will be eliminated outside because of unwanted, untimely manifestation of peristalsis. And that is what happens in psychogenic diarrhea. We talk about Bhayaja Atisara, Shokaja Atisara. What happens here is increased motility. Well, along with Atisara, I would like to remind you about Pravahika also. Pravahika, Vishuchika, Alasaka, the diseases related to the what kind of ama is it? If it is a simple form of ama, maybe just Atisara is enough to flush it outside. If the ama is serious, more serious, and it is from very long time, it is poisonous, if it is vicious, then Pravahika, Vishuchika, Alasaka will occur. So here, if Atisara occurs, well and good. But if Atisara couldn't clear the ama that is present in the lower GIT, then manifest Pravahika, Visuchika as well as Alasaka. Atisara may be a defense mechanism. Atisara may be one spontaneous way of elimination of dosha if the patient is lucky. But if ama doesn't go with Atisara, then that ama is definitely going to produce Pravahika, Vishuchika as well as Alasaka. It propels down, the accumulated kapha gets mixed with the little mala that gets excreted frequently with marked tenesmus as well as abdominal cramp. This is Pravahika. Pravahika is elimination of ama mala with pain as well as mucus. Coming to another completely different disease, Gulma. It is very mysterious disease because does it include ama? Does it come under any of these previous pathologies or is it an independent disease? The answer is Gulma is independent of all these description that I have spoken just now. It may or may not, most of the time may not manifest without ama. Gulma doesn't need ama here. It is an air trap where one air trap is there inside the GIT. To this air trap, there will be enveloping of pitta as well as kapha, giving murta rupa, grantivat rupa, an elevation. And that is why it is called as Gulma. Now, why the name Gulma? Because if you break that elevation, inside there is nothing. If at all, if it is mass, if you cut it into two halves, you can see it has a mass. But if it is vidridi, if you cut it open, you may get pus coming out of it. But if you cut a gulma into two halves, it's nothing but a hollow air sac. That is what it is, gulma. A general abdominal distension that have been described under the heading of udara. But udara is not gulma, even though there is distension. The localized non-suppurated swellings are gulma. Other localized swellings like vidriddhi roga, hernia, what we speak. But such swellings are in the regions of other part of the GIT, like scrotal region. So we'll not talk about vriddhi at all. It is completely a surgical disease. Shofa is an inflammatory swelling. Vidriddhi is an abscess, suppurative abscess where pus comes outside. Granthi is a nodular swelling, which is solid, hard, and inside it contains different kinds of materials. But Arbuda is the one which is having tissues inside. Gulma doesn't have any tissues inside. It is a bolus. After coming to Gulma, we are talking about Grahini. Here, Grahini, it is a very, very complex disease. See, whatever I said from first slide to now, if you mix all that, that is Grahini in a simple words, if I want to say. The digestion and metabolism is a major vital capacity, but if this is chronic, vomiting is chronic, Atisara is not treated, ama is not removed, it's not going outside, at the same time it is not converted into nirama. That compound, if continues to stay in the duodenum of the body, then only it manifests as Grahani. The ama, if it is in the large intestine, Pravahika, Vishuchika, Vilambika. The ama, which is stuck in between, which doesn't go up, doesn't come down, it is Alasaka. If ama in the amashaya, Chardi. But if the ama in the duodenum, it is Grahani. So that is why the name Grahani is been given. The disease has got wide spectrum of syndrome and often confuses the physician for diagnosis. Some symptoms like manifestation of loose stools and bowels alternative happens. That is what the cardinal symptom, Murbadda, Murdrava, may look like as a common symptom. And what if you want to treat it? If you want to treat Vibandha, the patient may have Atisara. And if at all, if the Atisara is to be addressed, then Samana Chikitsa has to be given, but it will stimulate manifestation of Vibandha. That is why it is a twin-bladed sword where the patient will have altered patterns. One day the peristaltic movement will be completely absent, zero. That day the patient may have Vibandha. One day the patient may have increased peristaltic movement. That day the patient may have Atisara. Now, who decides when it should be no peristalsis and when there should be more peristalsis? That is the ama that is present in the Grahani Pradesha will produce irritation one day that will initiate peristaltic movement that will lead to Adhisara. The same ama, if it is taking the asymptomatic phase, that time it doesn't produce any irritation to the walls of the GIT, because of which peristaltic movement cannot be unnecessarily produced, and peristaltic movement is not at all there for almost 48 hours. That time the patient may have constipation. And that ama can be, it has to be removed, only then this altered pattern of bowel can be managed. That can be discussed in other sessions. So Grahani is such a disease in which is difficult to diagnose and difficult to treat for this reason, because not only Atisara as well as Vibandha, it also has got lakshanas of Ajina, it also has got lakshana of Gulma, it also has got lakshanas of Atisara, it has got lakshanas of almost every kinds of disease, like including Pandu, manifestation of slight symptoms of Kamala also. That's why it is complex. The doshas, either individually or collectively, disturbs the functions of Grahani. That is what I told about. Sadushta bosho, bhuktamamameva vimuchyate. The pakvam vasarujam puti muhurbaddam hudruvam. Here, I told why there is difference in the symptom presentation. Why there is no Atisara only, or why there is no Vibandha only. Why there is altered pattern? Because of this dushta. The word ama is used here, or the word dushta is used to denote ama here. So here, whenever the person consumes fresh food, that freshly ingested food also will be converted into ama only. And that causes irritation, because of which the patient will have Atisara. Apart from that, when the GIT is dull and not having any peristaltic movement, that day the patient may have absence of bowel evacuation, that is Baddha. Well, so due to all these are the nidanas. I would not like to say that, because it's already told. Almost same nidanas for any kind of GIT disease also are told here. Whatever it is, due to the above said nidanas, the Agni, the components of Grahani, both here, why the word Grahani is given, because not only the Agni, here the Anga, which is Grahani, also is involved in the pathogenesis. Agni Dushti will never allow the normal digestion to happen. And to this Agni Dushti, the Grahani Pradesha, the duodenal walls, will respond weirdly. That is why Grahani Vyadhi is seen in this way. Well, this may look like irritable bowel syndrome. Of course, not all irritable bowel syndrome is Grahani. Grahani has got more range of diseases, which may include tropical sprue, irritable bowel syndrome, or it can be even mere constipation. It can be even mere abdominal bloating. Irritable bowel syndrome is one such symptom complex which can be included under the spectrum of Grahani. Just like you have 20 types of prameha, and not all prameha are diabetes, but one among the diabetes is prameha. Madhumeha can be correlated to prameha, but not the remaining prameha to just diabetes only. Here also, all Grahani, the entire Grahani Vyadhi cannot be correlated to irritable bowel syndrome. Some set of symptoms, maybe the initial phase of the symptoms can be resembled to irritable bowel syndrome. Well, the symptom complex are, again, here also it is two: constipation predominant and diarrhea predominant. So having frequent stools, urgency, straining, incomplete evacuation, mucus discharge, which may look like pravahika, like that of a symptoms, can be seen in diarrhea predominant irritable bowel syndrome. Otherwise, it can be constipation. Well, this is the pathogenesis of Grahini caused after food or waterborne diarrhea illness. Patient have growth of intestinal flora, which can give this kind of repulsive response or irritative response by secretion of mucus and other fluids, which can be expressed in the form of diarrhea. Or apart from that, there can be some other inflammatory response, and bacteria increase in number of WBCs, increase in the lining, and increased permeability of the intestine can happen. And this all can produce diarrhea predominant kind of irritable bowel syndrome. And apart from that, abdominal discomfort relieved by defecation, if it is constipation reached predominant symptom, any change in frequency of bowel movements occur along with the start of discomfort. A start of discomfort is associated with the change in the appearance of stool. So apart from that, there can be very few or excessive bowel movements each day. The patient may feel that he wants to defecate, but the peristaltic movement can stop abruptly in between, and the feces, which is about to get evacuated, may stop in the midway, and hence the patient may feel constipated. And if he exerts pressure, there can be hard or lumpy stools. This is one form. And the next day, there can be complete different picture: loose or watery stool, straining during bowel movement if it is hard and lumpy, having rushed to the bathroom if it is loose watery stools, feeling incomplete emptying if it is hard and lumpy once again, passing mucus if at all, if it is both straining also in hard stool also, in loose stool also, mucus passing can be there because it is a response to the inflammatory changes happening in the GI. Abdominal fullness, bloating or swelling occurs if at all, if there is retention, impaction of stool there. Patients with IBS are more commonly than have other gastroesophageal reflex symptom related to genitourinary system, chronic fatigue syndrome, headache, backache. All these are because of improper dhatu poshana and because of mala sanchaya. And mala sanchaya can cause utpatti of visha in the body, and this visha can produce different kinds of cytotoxins, and these cytotoxins can reach any cell. It may go to the musculoskeletal system and cause muscle fatigue. It may go to the neural system, and it may cause even dangerous diseases in later stage of life, like Alzheimer's also. So depression, stress also. So depends upon what kind of cytotoxic materials are synthesized when the stools are accumulated or when mala is accumulated. Well, investigation, I think you already have one session for that, so I would like to skip this. Okay, the very few are left out. Coming to Udara is another GIT, not only GIT, but it includes other non-GIT manifestations also, but I will focus only on to that part of Udara which is much related to GIT or Annavasrutas related. The term Udara refers to the abdominal structure, abdomen, but in the context of Roga Vijnana, Udara refers to a disease in which the cardinal feature is marked as abdominal distension. This is due to accumulation of fluids and doshas in peritoneal cavity, which produces bulge. It may also be seen as secondary disease to Kamala, Arbuda, or any organomegaly inside the abdomen. The abdominal distension due to fat, fetus are not considered as Udara. The disease presenting with cardinal symptoms of generalized enlargement of abdomen is regarded as Udara Roga. So all kinds of organomegaly, so Yakrutodara, Plehodara are organomegalies. Intestinal rupture, the Chidrodara is that one. Fecal impact, that is Baddagudodara. Ascites, the Jalodara. So this correlation is possible. After that, I'll come back to ulcerative colitis. It is again, some say some aspects of ulcerative colitis can be resembled with that of pravahika. It may sound like dysentery, but ulcerative colitis also can be thought about it here. We can also think about chronic stages of Grahini also. So it is a combined aspect of both Grahini also, pravahika also. Ulcerative colitis is a disease in which extensive areas of the walls of large intestine become inflamed and ulcerated. The motility of allotted colon is often so great that the mass movement occur most of the time rather than that of a usual 10 to 30 minutes per day. So it's very, very painful. All the colon secretion are greatly enhanced. As a result of the patient has repeated diarrheal bowel movement. So Vishuchika, Pravahika, Grahani, and Sanipata Jatisara, all can be considered here depending upon the avastha of the disease. Acute stage, initial phase, you can think about Atisara. The chronic phase, you can talk about Grahani. But even later forms is Vishuchika. The cause of ulcerative colitis is unknown. For some clinicians believe that it results from allergic or immune destructive effect when we talk about modern aspect. But again, I told you, whenever there is ama present in your body, asatmya, ahara sevana, all this allergy, autoimmune, hypersensitive response, inflammatory response are nothing but the initiators from the asatmya. Asatmya gives all these things. Okay, so when ama is there and when the person is consuming asatmya ahara, asatmya plus ama that is present, both will initiate allergic, autoimmune, as well as immune destructive effect. And if it is occurring in the distal part of the GIT, the result is ulcerative colitis. Whatever the cause, there is a strong hereditary tendency for this, apart from ahara janidana or apart from being previously sensitized to asatmaja ahara. Genetic tendency is also there, but let us not go into that because ultimately the symptom is the same. So this is what happens in the ulcerative colitis, where different phases of the GIT, multiple places, there will be patchy areas which is eroded with ulcers, and from these ulcers there can be oozing of discharge, pus, blood, and these discharges gets mixed with the stools, and when stools pass by these ulcers, again the wounds gets contaminated, the ulcers become even more bigger, the symptoms gets worsened when the stools pass by, and when the patient defecates, it will be very, very painful because stretching of this muscular gut also will cause pain. Passing of the stool with this ulcer, because all these are open wounds, will cause pain. Oozing of the blood, mixing of the blood, pus, and the desquamation of the dead tissues also produces different colors in the stool. Blue, red, dark, yellow. All these are the colors that can be present along with the regular stools. Well, once the condition has progressed very far, the ulcers are perpetuated by superimposed bacterial infection. That is what happens when I said already there is an ulcer. And what is worst is the stools are traveling through these, and the stools do have different kinds of microorganisms, and it can be superimposed by bacterial infection, not only by that, from other reasons also. And hence, worsening of the ulcers occurs because of this. This is a difference between manifestation of ulcers in the distal part of the GIT and manifestation of ulcers in the proximal part, that is stomach as well as duodenal part of GIT. Even though both are ulcers only, but there is a world of difference between these two ulcers because different kinds of enzymes are present, different contents pass by in these areas. Even the ulcers sometimes fail to heal, and only solution them to might removal of the entire colon, because healing of ulcers cannot happen, and this can lead to chidrodhana. Well, again, I'm talking about inflammatory bowel disease because it's ulcerative colitis as well as Crohn's disease are again forms of inflammatory bowel disease. So why I have, because there is a lot of similarities, which exactly we may not be able to correlate, yet a lot of similarities are there, and ultimately what has to be done here is cleansing of the ulcers, removal of the stools, and healing of the ulcers. So that is why Picha Basti or Tikta Rasak Shira Basti, which not only eliminates but also heals, staying nil per mouth, keeping the GIT patent by passage of any stools, are also different points to be noted during the treatment of such ulcerative colitis as well as Crohn's disease. So coming to Crohn's disease, the symptoms can be abdominal pain, which can be shown in the form of shula, diarrhea, shula, atisara. So it can be resembling to that of either pravahika. In the chronic condition, an individual will have more than 20 bowels, flatulence that have ended up in intestinal discomfort, itching sensation, or pain around the anus. That is because of different secretions, fistula or abscess around the anal area because the pressure is too high there, and the contents of the colon will find an alternative pathway to get eliminated outside, and that is how fistula or nadi vrana can be produced. Apart from that, the extra intestinal manifestation can happen. That is not discussed that now, right now. Other symptoms can be clubbing, blood clots, osteoporosis, autoimmune hemolytic anemia, malabsorption, malnutrition, colon cancer, neurological complications. So it is nothing but the mixture of symptoms of Grahini, Vishuchika, Alasaka, as well as Vilambika. That's what I'm going to talk now. It is the most aggressive form of ama than any other in the previous. The ama is mild in Chardi, but ama is the most aggressive in these three conditions. So the level of ama varies from upper GIT level to lower GIT level. ama can be mild and less aggressive if it is there in the upper GIT. As ama comes down, it can turn more aggressive, more Vishwarupa, rather than you need not call it as ama, you can directly call it as Visha. So the undigested annarasa possessing odor with high viscosity, causing obstruction of channels and various disease is called as ama, which produces dosha dushti first, spoiling the quality of dosha or humus of the body. This is the first stage of ama. And this stage, just aruchi and agnimanya may occur. Dhatu poshna, hampering. This may occur again in the later stages. Combined with element and circulation with the srotas, that is the third stage. Here is a stage where chardi and atisara occurs. Srota dushti in the form of obstruction and circulating the channels or vessels. This is the place where this is like grahani occurs. Reaching a new organ and causing destruction of that organ and finally leading to manifestation of the disease. And not only manifestation of disease, if it is still continuing, then it may start eroding the lining of the mucus, producing ulcers, perforations. That is what in case of Alasaka, Vishuchika, Vilambika. Here it is told. So the types of disorders that can be caused because of Ajirna Mamam, that is Vishuchika, Alasaka, as well as Vilambika. Vishuchika is characterized by sudden vomiting, diarrhea, and pricking pain in the abdomen. Okay, so ama is still in the koshta, but it is releasing cytotoxin because of which the brain is confused from where to remove what. So here, the gut-brain axis is getting stimulated because of which the peristaltic movement of the entire GIT increases. Upper GIT produces vomiting, lower GIT produces diarrhea. This is what happens in Vishuchika, the advanced stage of ama. A frail patient having weak digestive power and aggravated kapha condition, even exerting pressure is not able to eliminate the undigested food out of the passage. And this condition is called as alasaka. This is the time where the complete intestine becomes transiently paralyzed. What we call it as paralytic ileus. We can resemble to alasaka to some extent, where the patient will not have any kind of peristaltic movement. So the propulsion, transportation, elimination cannot happen either in upward direction or in lower direction. It gets stuck once again inside the koshta or in the mid-gut. That is why it is called as alas. In the middle of the gut. That is why it is called as alas. That is what abdomen is distended excessively because of niruddho marutascheva kuksho paridha. Here, the patient will have absence of elimination because of marutta dushti. Here, obstruction to the pathway happens at one particular point. The GIT produces hyperactive movement where the Vishuchika occurs. And in the contrast, another form of manifestation of ama is where Vata gets freezed. Vata makes the GIT completely freeze down, turn paralytic, because of which no movement at all occurs, and hence the feces, flatus completely gets stagnant as well as stuck along with the ama. Now, the patient suffers from thirst, obstruction to eructation. All those things are the features of alasaka. Why? Because the patient feels restless. He wants to drink water, he can't drink water, and he wants to vomit, but nothing comes outside. He wants to defecate and clear the bloating, but that's not coming outside. Restlessness is felt by the patient because of stagnant dosha. It is a very, very severe form of alasaka. Vilambika, the ama which is produced in Amashay, will stay inside the koshta for a long time. As I already told, I'm just repeating the same thing. I'm just done with the explanation so far. I'm just using the Shastra reference. Dushtam tu bhuktam kapamarutabhyam pravartate norda madasya vilambikatam. This condition is called as vilambika, where the Agni deteriorates the digestive power and the ama deteriorates the digestive power and contributes further to produce as well as provoke ama. The food gets stagnant and remains undigested if at all if the person is eating new food. See, here the already ama is there, and when the fresh food is consumed, and that fresh food is immediately converted into ama, and even though the GIT is there, ama will not allow the GIT to undergo digestion. This leads to fermentation that produces toxic features in the body and more symptoms of ajirna. So vilambika is caused due to kafadushti and vatadushti, along with accumulation of ama. So as kapha is there, stagnation is there, as vata is there, sangha is there, and both vata as well as kapha with ama produces vilambika. I would like to tell one more disease, Kamala, and I'll end up. In what way Kamala is related to GIT? Because Yakrit is one of the anga which contributes a lot as a pittasthana in the digestion. And that is why Kamala is included under GIT. And the cardinal symptom of Kamala is absence of desire of food. Kama, la, absence of desire for what? For food. And absence of desire occurs because it is filled with mala. That is why in the presence of mala, there is no room for the fresh food to come and produce digestion. And the pitta, which is synthesized in yakrit, is too much. Bahumalam or bahu pitta accumulation takes place, because of which, because of the stasis of pitta in the GIT, the impregnation of the pitta occurs in other places wherever pitta is present. Pitta is present as a brajaka pitta in skin, so yellowish discoloration of skin occurs. Pitta is present in the eyes as alochaka pitta, yellowish discoloration of conjunctiva occurs. Pitta is present in the koshta, and whatever eliminates from the koshta as mutra and purisha becomes yellowishness. So bahu matrata of pitta in the form of pigmentation is kamana. So bahu matrata of pitta in the form of enzyme is amla pitta. Bahu matra of pitta, which is a pigment, that is kamana. Bilirubin is a pigment. HCl is an enzyme. Both are pitta. Increased HCl is enzymatic increase of pitta in amla pitta. Increased pigment as increased bilirubin is present in kamala. That's the only difference. Otherwise, pitta vriddhi is there in amla pitta also, pitta vriddhi is there in kamala also. So which form of pitta? Number one is enzymatic form of pitta, agnirupi pitta, and another one is pigment form of, or the color, varna is the one which is imparted from pitta. That part of pitta will be undergoing dushti. The ranjaka pitta, which is the one which is giving red color to the blood, and that will be completely destroyed, because of which malarupi pitta is produced. And you know very well, one of the mala of rakta is pitta itself, and that pitta is nothing but bilirubin. Excessive bilirubin is produced because of excessive destruction of rakta, and that excessive bilirubin goes out from the body, and while going out of the body, it gives pigment to the mutra as well as purisha. And rakta is present in every part of the body, and the place where it resides is tvak also, and hence tvak, nakha, netra, jivha also will become yellow in color. To end up, I will end up with udavarta. This is another, some say udavarta is not a vyadhi, some say udavarta is a pathology. It is one of the samprapti, not a vyadhi as such, whereas some consider it as vyadhi also. It's up to you, because when you give chikitsa, it is the pratimargaharana chikitsa what you give. urdhvagati of vata happens, and which one you are bringing it down in the form of anulomana or virechana. Normally, the apana vata moves from upward to downward direction, and udana vata moves from downward to upward direction. If the patient has got his udana vata moving from downward to upward movement, such condition is called as udavarta. See, the patient can have vibandha or constipation because of udavarta also. The patient can have constipation because of grahani also. The patient can have constipation because of paralytic ileus, that is alasaka also. But chikitsa is different. Even in modern science also, constipation can happen because of improper, incomplete stool formation. Constipation can happen because of obstruction in the distal part of the GIT. Constipation can happen because of drying up of the mucosal lining of the lower GIT. Constipation can occur because of hardening of the stool also. But the treatment is different in different conditions. So you can give Phalavarti in one condition, Virechana in one condition, Basti in another condition. So Udavarta is one condition where you will stimulate the enteric nervous system and felicitate the reverse downward direction peristalsis, not the reverse peristalsis. You are avoiding the reverse peristalsis and you are regulating the normal peristalsis of the person. So that is called as Udavarta. If a patient comes to you with a constipation, how to know whether because of what it is Udavarta? See, along with constipation, if the patient is having problem in Mutra Sarana also, if she is a woman, she is having problem in her menstrual cycle also, she is feeling bloated, even Apana Vata is also not, or flatus is also not getting eliminated properly. Upon that, she is having constipation. Then please diagnose it as Udavarta, because Apana Vata is the one which is giving rise to defecation reflex, flow of the menstrual content, flow of the urine, and of course, once in a year, the flow of fetus also, the act of ejaculation also. If all these activities, except maybe prasava that is held up, if you consider, if all are there along with constipation, then it's better to diagnose it as Udavarta. And another symptom to diagnose Udavarta is presence of halitosis, foul smell, bad breath. So having constipation plus foul smell in the mouth is direct diagnosis for Udavarta. And many clinical conditions you can come across and you can diagnose it as Udavarta, and you have added that, considering it as a Vyadi and not just Samprapti. I feel it is a Vyadi, not just Samprapti. Yes, this is what happens in different kinds of Vibandha. So the patient is having tight, in the first picture, you can see the tightness of the outlet. Stools want to come, but the anal canal is constricted because of spasm there. Another condition, the fecal matter have become dry and stuck in the midway. That is Srishta doshatva. And in another condition, it is there, the lining of the GIT is too dry, because of which peristaltic movement is not there. And hence, because of paralytic ileus, the stools are stuck, as in case of alasaka. And in another condition, last picture, you can see something purple. There's some other obstructive pathology is there. And because of the presence of obstructive pathology, maybe gulma, maybe arbuda, because of which the sangha is there, and hence the patient cannot defecate. So looking into the condition, you can diagnose which kind of vibandha it is. Now, why I told arshas? Because arsha, for every kind of arshas, vibandha is a puro rupa. Any patient who comes to you with arshas, please talk to him. Initially, he had constipation. So if the patient comes to you with constipation, treat him before he leads to arshas. If he comes to you with arshas, see that he is not having constipation, clear his constipation, and then treat the arshas as arshas tikitsa, whether medically or surgically, depending upon the size. Sorry, I took a little long time. I think I can conclude with this slide. I'm very thankful to the organizers for giving me this opportunity, and I shall leave this platform back to the organizers for answering your queries. Thank you for your patient listening.
Thank you so much, ma'am. It was indeed a very elaborate explanation of both the Ayurvedic and as well as the modern concepts of different gastrointestinal disorders. We will take up the discussion or the question and answer session now. There are a few questions in the chat box. I will read it out for you. Okay. Shwasa is a pranavaha sroto dushti vyadi. Amashaya udbhava, then why tamaketu virechana has been told, why not vamana? So the very common doubt.
Yeah. Am I audible?
Audible, ma'am.
Yeah. Yes, you are right. It may be a very common question. There are three answers for this, whoever has asked this. Number one, the patient who has got indigestion, bloating, and accumulation of lots of fluids in the abdomen, in such individuals, because of increased abdominal pressure, the diaphragm will move upwards. When the diaphragm is upwards, the lung capacity is less. So the patient will find difficulty in breathing, including Tamakashwasa also. So when we give Virechana, what happens? The excess accumulation of fluid will be removed and the diaphragm comes downwards. Bloating is alleviated, the diaphragm comes downwards, and because of which lung capacity is improvised and the patient has got good room for respiration. This is one thing. This is first and foremost answer. Second answer is, as I said earlier, in the ama contains those materials which can trigger, stimulate inflammatory response. The allergens, the cytotoxins, the inflammatory materials, chemotaxins are synthesized there, and it may go to the respiratory system and produce irritation to the respiratory tree in the form of bronchospasm or in the form of production of too much mucus in the bronchial tree. When you give Virechana, these allergy producing materials which utpatti happens in the amashaya or in the GIT are all removed. When the ama is removed, the inflammatory responses, allergic factors, all are removed, and they will no more go to the respiratory system and produce any kind of irritation like bronchospasm or mucus that can block the respiratory tree. This is the second answer. Third answer, yeah, as I whenever you give Virechana, it is not only for the pitta, it is also for the rakta also. So what happens there is when you clear the GIT, the absorption of GIT will be enhanced. Bioavailability of the food as well as medicine will be enhanced. Because of this, rakta utpatti will be enhanced. When the rakta utpatti is enhanced, when good amount of blood we have, that means good amount of hemoglobin you have. When you have good amount of hemoglobin, obviously the oxygen carrying capacity will be enhanced, because of which the patient will have adequate amount of hemoglobins that can carry adequate amount of oxygen in your body. So these are the three answers why Tamaketu Virechana. Number one, the abdominal volume will be reduced by reducing bloating and distension, because of which diaphragm will come down, because of which lung capacity will be enhanced. Number two, in the abdomen where ama, what you call, that will be synthesized, and these ama are the triggering factors of the inflammatory response, inflammatory factors that can stimulate the respiratory tree to cause bronchospasm as well as mucus that will be removed along with Virechana. Number three, Rakta Utpatti is enhanced, because of which hemoglobin Utpatti will be good, and anemia can be also cleared, because of which oxygen carrying capacity also will be good, and overall health of the individual increases with cleansing of the Rakta. These are the answers for Tamaketu Virechana.
Thank you, ma'am. Dr. Ujjwala, hope your your question has been answered. Dr. Nalini is asking, Dinapaki Ajirna में treatment क्या देनी चाहिए?
In Dinapaki Ajirna, Trikatu Churna along with Ushnodaka or Panchakola Fanta is enough.
Okay. So every person suffering from Grahani because of lifestyle, is it correct?
Yes, I agree with the fact of this, because it's not lifestyle is not only in the form of stress. So everybody please think in the morning. I just told about melatonin as well as pancreatic juice. Maybe your pancreatic juice is not yet secreted and your melatonin level is still there. You still feel sleepy. I used to use public transport when I was going to my college. So many people used to sleep in the bus, women, elders, everybody. And I'm very sure about their breakfast. Either they had their breakfast or they didn't have their breakfast. So obviously there will be some impairment in the kala as well as biological clock as well as their Jeena Lakshanas. Stress plus change in the timings of the food, the quality of the food, fast food, all this will combine and definitely will cause grahani. The point is correct. Lifestyle will cause, bad lifestyle will cause grahani. I agree with that.
Ma'am. Many of our participants have are giving review. Thanks, ma'am. Very nice class, slow and clear explanation. Krishna Prasad is saying. Pranjali says, thank you so much, ma'am, for a great class.
Thank you.
And okay. Dr. Naila says, ma'am, the way you explained GIT was marvelous. I don't have words to explain how beautifully, in a simple way, you have made me understand the most complicated system in both Ayurveda and modern aspect.
Thank
So
you, Dr.
happy that I joined your session. May you
Glad
God
that
bless.
you are here. Glad that you are.
Okay.
Thank you.
Okay. Next question, ma'am. So Pranjali is asking how to understand Sangraha Grahani and Gati Yantra Grahani.
Yes, Sangraha Grahani, Grahati Yantra Grahani, well, they have to spoken about this depending upon the chronicity. Well, clinical practice, there may be no much availability of such examples. You believe me or not, in my entire life, I saw only 2 patients of Gulma. Even though in text it is said to be one of the important chapters, it is mentioned in Nidana Sthana. Gulma is one of the Nidana Sthana, one of the chapter in Nidana Sthana, and if it is mentioned in Nidana Sthana, that means definitely it is common disease. But in clinical practice, we don't see Gulma manifesting that common. And in this also, Sangraha Grahani, Gati Yantra Grahani, you can just talk about Leena Dosha. I can tell you that much. Just like in case of Vishama Jwara, Grahani, as well as Apasmara. These are the 3 diseases where you have Leena Dosha, even Tamaka Shwasana, Leena Dosha, where you have manifestation of Grahani in episode, Pakshat, Masat. So once in 7 days, there will be Grahani. Other days, he'll be normal. Once in 15 days, like that. And in Gati Yantra Grahani, that intestinal gurgling sound, whatever it is, it tells about the morbid dosha when it is active and when it is not active. When the doshas are in little quantity, they will not produce much symptoms. And that day you ate something bad. And that time the symptoms will come outside as attack or as an episode. That is what you can talk it as Sangragrani, which will manifest as a Leena dosha, episodic, periodic, after certain days only it will come, not every day you cannot see that. That is how you can understand Sangragrani. Gati Yantragrani in the form of intestinal sounds, that is what you say when the abdomen produces toxic gases like methane as well as hydrogen. So that produces, when such gases are produced, definitely the intestine will try to remove it as much as possible. The gurgling sound when such toxic gases moves produces such kind of sound. And if it is not getting eliminated timely, yes, it is again toxic. And you might have heard about this. The flatus, which emits very, very offensive odor, says that the patient has got Gati Yantra Grahani. So many a times, of course, everybody has a typical ammonia smell to the indole smell to the feces, but it can be very, very offensive in case of Gati Yantra Grahani, almost like methane, just the cooking gas that you have, like that only you may get it. So that toxic gas liberation is Gati Yantra Grahani. Leena dosha manifesting in episodes is Sangraha Grahani.
Thank you, ma'am. Okay, the next question, Dr. Rati is asking how some people after taking food go to motion. What should be given?
Well, yes. Well, again, just they are having Mridu Koshta. That is the one you should note down. Such people, you have to note down what kind of food they are having. They are having such response. Not all kind of food they may have that kind of reflex. Maybe gluten, milk, such conditions, they may have this kind of response. Please remake their diet plan. So in such conditions, advising Shali is better rather than white rice or urad dal. Please avoid urad dal, wheat, as well as this one, milk. and anything that contains protein. You can go with little amount of carbs and fiber-rich diet you can go with. And if you want to go with the treatment, again start with Agnitundi Vati, then go with Chitrakati Vati for 5 days, and then start with one small Anulomana with the help of Avipatti Karachurna, and finally give Takrarishta, and after Takrarishta give Jirakavale. So Jiraka is carminating, Shunti is carminating. It will absorb, it will enhance the absorptive capacity of a person, enhancing Agni, at the same time strengthening the gut. Both are important. So kindly practice this. So starting with Agni Deepana with the Agnitundi Vati, Chitrakadi Vati, then giving one Anulomana with the Avipatti Karachurna. That is how you cleanse it. Then you have to strengthen the GIT. That is by giving Jira Kavale. Before that Takra, then Jira Kavale.
Thank you, ma'am.
Yeah.
Dr. Ujwala has raised her hand.
Yeah.
Dr. Ujwala, you can unmute yourself and ask any question if you.
Good evening, ma'am. Very nice session.
Thank
and
you.
I have asked the first question about Tamaketu Virechana.
Yeah.
So, ma'am, when we can give Vamana, because sometimes we give Vamana also, na, like in Vasantik Vamana.
Yeah.
So usually I will not give any Shodhana therapy. I will give only Shamana therapy always.
Okay.
So that's why I have this Shodhana question about Vamana and Virechana. So how to differentiate when I have understand what you have told about Virechana, but when we can give Vamana to the patient.
Okay, so there is something called as Vegavastha as well as Avegavastha. So there is also one opinion that during Vegavastha, better don't give Vamana, go with Virechana, and during Avegavastha, go with Vamana because it is distressful. Vamana is distressful. Definitely, Vamana is not the first choice when it comes to distress. Well, another thing is if it is Kafolbana, if at all, if the patient has got a lot of mucus adherence inside the bronchial tree, phlegm is coming outside, and if the respiratory distress is because of mucus production, then Vamana is very good. And if at all, if the patient is having Shwasa because of bronchospasm, then Virechana is better. So Kapha Pradhana, when there is Utklesha, when there is nausea otherwise also, and the patient feels, see, you know very well, Tamaka, there is one symptom where the patient will have cough, and after spitting the phlegm, the patient feels better. And if you have that feature in the patient, Vamana is the best choice. And otherwise, there is no much phlegm, very less amount of phlegm is there, just wheezing sound is there, and there are triggering factors like perfumes, pollen and all, then you go with Virechana.
Okay, ma'am. Thank you so much.
Thank you, Dr. Ujwala. There's one more question in the chat box, ma'am. Body ache and acidity after food. How can we think about this?
Yes.
How to understand?
Yes. There is a chapter called as Daha in Madhavanidana also, where the patient feels burning sensation. What happens here is when the body produces excess amount of such kind of enzymes, especially GIT. So along with the GIT, it also goes to the distal part of the body, just like you have bilirubin everywhere. In the same way, sometimes these acids also may go and irritate the nerve endings. So that is how body ache it gives. So maybe there was a great cricketer, Virat Kohli. He also had a same problem. So he had severe neck pain and back pain. And it was, everybody thought it is because of practice and muscle pain and or something. But later it was noted that he had severe amount of acid production in the body. So his the acid that is produced in his body used to eat the soft tissue of the body, cause erosion. So because of which he used to have this muscle sore, muscle ache and body. Whenever the muscle ache is there, obviously body ache will be there. So that is how he has changed himself into vegan. Because meat consumption increases acid production in the body. That is how he has maintained his acid levels by converting himself to becoming a vegan. He only eat vegetable source. Of course, I'm not having any comment about the food choices, but that is how his body is now responding by producing minimum amount of acid by consuming only plant-based food. So this is the reason. just like the blood circulates everywhere along with the rasa, when it travels all over the body, when pitta is excessively produced, that may be carried to every part of the body, and muscles will identify this sensitivity and they show it in the response of producing different kinds of aches. That is how body ache happens in case of hyperacidity.
Thank you, ma'am. Next question. Ma'am, in IBS patient, along with Deepana, should we add liver tonics also?
Yes, definitely. Why Agni Deepana? Because as every disease starts with Ama, Pachana, Agni Deepana has to occur. That's why we are giving Agni Tundivati and all. Apart from that, if Ama doesn't turn into Nirama Avastha, then there is no continuity of treatment. Whatever you give, that it will not be helpful at all. That is why before Shodhana, before Snehapana, we give Ama Pachana as well as Agni Deepana to remove Ama. You have to start any treatment for GIT with Agni Deepana Dravyas, but ultimately end up with Rasayana, Balya, Rasayana you are giving. Here in IBS also, definitely one medicine or just Agni Deepana is definitely not enough. You have to give Agni Deepana, then you have to remove the ama that is accumulated in the body. Then you have to give enhancers. You have to give liver tonics to enhance liver. You have to give carminatives to enhance absorption. You have to give Grita as well as Avaleha to improve gut health. Yes, in total, complete Rasayana it needs. Grahani is a complex disease. You are right. You can add liver tonics also to it.
Hope your question has been answered, Suman. Dr. Rati has one more question. One patient I have seen, his Agni is good, but he's passing his stools daily 4 to 5 times. No other issues, but weight gain is not there.
Yeah, this is what we talk about the Mrudu Koshta also, where the patient has led to malabsorption. Here you have to give Grahi Dravyas, carminatives. So Saubhagya Shunti is very good, where the patient will have better absorption. The food is digested. Digestion is okay, but absorption as well as assimilation, as I said earlier, Pachana, Paka, Parinama, 3 has to complete. Only then there is completeness. Here also, in your patient also, digestion is complete. No problem with that. After the food is digested, that food has to be absorbed. No, that absorption is not happening. Whatever the food is digested, that goes along with the stools. And here we are talking about Samanavata. Samanavata is the one which is differentiating Sara as well as Kitta. And in your patient, Sara Kitta has produced, Avastapaka has produced. Nishtapaka also is over, but when Vipaka is over. But during Nishtapaka, Sara Kitta Vibhajana, that time Samanavata has to do this. That's not happening. So both Sara also, Kitta also, both are going along with the Mala. And as Sara is not there, Dhatu Poshana is not there. And as Dhatu Poshana is not there, your patient is not gaining his weight. So what you are supposed to do is, you have to enhance Samanavata and promote Sara Kitta Vibhajana. Sara has to go to the Dhatu Poshana and only Kitta has to be eliminated. And this is a time where you are supposed to think about carminatives. Shunti, Saubhagya Shunti does this. And even achieving a Shunti with that of lemon, which is soaked with the takra and dried under the sun. Many, you will get this in
Ginger
many
chat.
shops. Yeah. That is very good. That is very good. And finally, Jeera Kavaleha also will be good. Jeera is very good in this. Any product, you can Jeera ka font also if Leha is not possible. Because initial stage, if you give Jeera Kavaleha, the patient will have more diarrhea because again, Grita is heavy for him to digest. So start with ginger chat, whatever I just told, then go with Jeera and finally go with Jeera Kavale. This will enhance his absorption capacity.
Thank you, ma'am. Dr. Naila is asking, why does severe cramping pain occur in the rib area when someone turns to pick up things from upper shelf or turns around or bend down?
Again, it depends on the area. So if at all, if the patient is having the right hypochondric region and while bending or while breathing, if at all the pain occurs, then it is some pathology in the liver, either gallstones or slight hepatomegaly or slight fatty liver can be there. If, of course, not a healthy individual I'm talking. Persistently, if the patient is having vague muscle cramp, irrespective of right or left or something, locomotor system, so then there can be some issues with that of a deficiency of protein. Muscle protein is very less. So better enhance MAMSA there, or also the calcium, because sometimes spasm or cramp occurs because of sodium calcium impairment. So having lemon juice along with the pinch of salt or saindava can help enhancing the electrolytes. So look into the factor. So if at all, if it is particularly in the rib of the right side, just above the right hypochondrium, you have to focus on the liver. In the back side of the rib, just in the trunk area, it may be ureteric colic. If it is vague anywhere or all over, or only if it is related to calf muscles, then it must be electrolytes.
Thank you, ma'am. There's one more question. Can you please specify the dosage that you advise to follow? Agni Tundivati, Chitrakadivati, Avipattikara, and Jirakavaleha, you earlier mentioned, for the condition of passing stool soon after having food.
See, for Agni Tundivati, 2 TID before food. Chitrakadivati, 2 TID also. That is after. And this you give it for 7 days. Then after 7 days, you give Avipattikara Churna, half teaspoon early in the morning, along with hot water. Give it for 5 days. After the Agnitundi and Chitrakadivati course is over, then you give this Avipattikara Churna, half spoon, morning, empty stomach, with hot water. Then gut movement, cleansing will happen. Then once it is done, then go with Jira Kavaleha, that is Balya Rasayana. So once in a day, 1 spoon after breakfast, you can have along with the milk. If milk is allergic, then better just hot water is enough, because some people cannot handle milk, because nowadays milk is, that packet milk, mixed dairy, of course, that itself is a visha. Then it's not like olden day milk. So I will not suggest kheer at all. So it's better to have with warm water only. 1 tablespoon of Jeera Kavaleha with warm water, morning.
Next question. In acidity, soft tissue digestion and weight decrease occur. What will be the line of treatment?
Again, Vamana is good. So that too, with the simple salt water Vamana has to be done. At least once or twice is okay. Then once the Vamana is over, Ullek I would like to say, I won't use the word Vamana also. So already doshas are in Utklesha Avastha there. Easily it comes outside, Tiktasat and all will go. So that is then Dhanyaka Kashaya is good as it will act as a Shamana. Dhanyaka is a very good pH neutralizer also, Pittahara also, and the aroma also can reduce the feel of Daha, Tiktasyata, Praseka, Rochaka also. That will be sufficient, and then can go with Lagusutta Shekhar Rasa.
Thank you, ma'am. Okay, next question. Ma'am, in case of migraine, along with the Amapachana, Agni Deepana, can we give something like Bunimbadi to take care of Pitta along with the liver?
Yes, definitely. It's a very good choice of medicine. Can go ahead, definitely.
Okay. Jeera Kavaleha in empty stomach?
No.
After food.
After.
Okay. Saubhagya Shunti dosage?
Just it's available in pieces, no? Just 2 pieces, enough.
2 pieces. Oh.
Yeah.
Okay, ma'am. Any more questions from the participants? Any further questions? I think there are no more questions.
Yes,
okay,
Saubhagya Shunti after food. Yeah.
Okay. It's already time. Ma'am, thank you so much for elaborately explaining the concept, as well as very patiently answering all the questions. It just shows the amount of adhyayana you have done on this particular topic, and all our participants are they're giving very good reviews, and everybody says thank you so much for joining us today. It was indeed a very engrossing session, I would say. Dr. Jasul, would you like to add anything?
Thank you, ma'am. Even the first minute itself, it was very interesting to hear you the entire session, and you have a good voice, and the flow of your class was very excellent. Thank you, ma'am. Thank you so much for coming. and sharing the knowledge. Thank you.
Thanks,
All-
Yusuf. It was wonderful interacting with all of you. Thank you, Akshata.
Thank you, madam. Thank you so much. And thank you all participants. So we will see you all in the next session of Dahana. Until then, signing off. Shubharatri, everyone. Good night.
Good night. Thank you.